Welcome back, everyone. Well, it's summertime. We're all outside. We're in the woods. We're camping, and there's a disease out there called Lyme disease. I know you've all heard about it, but there's a certain mystery about this disease. You know, how do you get it? How do you treat it? What are the symptoms? So we decided to bring in Dr. Dean Limeri. Now, Doc, welcome.
Thank you.
Nice to have you here. Doctor is Medical Director, Primary Care at Ellis Medicine. And over the years, you treated quite a few patients at varying times for this disease, correct?
Yes, we have.
All right, so Doc, let's start by just reminding people how you get this disease.
Sure. Lyme disease is transmitted by a deer tick, which has been infected with a parasite. And if you are bitten by an infected tick, and the tick has enough time to feed and transmit, and takes a long time, that you may develop Lyme disease.
Right now, before we went on camera today, I was telling the doc that, just this summer, springtime, I was out in the woods, and 2 days later I noticed, my goodness, what is that on the bottom of my arm? And it was a tick, and it had already taken hold, and it started to develop that rash. The first symptom for a lot of people is the rash, correct?
That's correct.
And two types, I think you told me.
There are. We'll go and start. When you get bit by a tick, if the tick is on there less than 36 hours,
right,
the odds that you're going to get Lyme disease are very slim. But if a tick is on there, you discover it the next day or two, because a lot of people don't know, you don't feel the tick, then there is that chance. The rash, as you mentioned, comes in a couple different forms. It usually will occur within a week to 2 weeks, but can take up to a month. The most typical form that we all see and hear about is a rash called erythema migrans. And it starts out small, as like a little red patch, but it gets larger. And as it enlarges, the center clears out.
So it begins to look like a target.
Exactly.
Yes, right.
And that's the typical characteristic, as we like to say, textbook rash that we all recognize immediately. However, it can also appear not as familiar, in just like a patch of redness that's there for a bit and goes away, and you never get that enlarging circular typical target-like lesion. And that one is missed the most because people just are not familiar.
Right, so say you're a couple of days in, you discover the tick, you realize that you've got to call a doctor and get some treatment. Do you recommend they remove that tick at that time? And if so, how do you do that?
I recommend that they can remove it if you know how, and it's very simple. And what's recommended is to take some very fine needle-nose tweezers, firmly grasp the tick as close to the skin as possible, and pull straight up. And sometimes you have to give a good firm yank because they really can grab
they
on.
embed themselves. Yes, they do. Right.
Yeah, and generally the tick will come out. If for some reason you don't get it all and parts of the head break off, don't bother digging it out. It won't hurt you. Just let it go. And you've got a souvenir, as I tell people.
And that one part about getting the head out, you hear about this, and then of course you hear the other things. Oh, it's got pincers and it's got all this stuff. I think the main thing is just get as close as you can to the skin and give that thing a good yank. And you're right, they like to embed themselves in there.
Yeah.
And then pull it off. Then seek some medical help. Right?
I think if
you do a
it's
blood test.
I don't know. I think if you yank a tick off and it's less than 30 hours, you don't need to see the doctor at all.
Okay.
If it's longer than that, then I think it's reasonable to come in and have a discussion. If somebody has no symptoms and say you've had a tick on there for 40 hours or so, there was a study now probably about 12, 13 years ago, which was actually done down in Westchester County, very high Lyme endemic area. And what they showed is in these folks, if they got one dose of a medicine, doxycycline, 200 milligrams, once, that their risk of getting Lyme disease dropped dramatically.
Right.
Not to zero, but it dropped dramatically. So we will do that with some people who have no symptoms but had a tick for a long time and managed to pull it off. If you get symptoms, then what do we do? If it's early, And early meaning you get the characteristic rash.
Right.
There's no need to test. You've got it, and you just get treatment for the disease. And again, the easiest drug is a drug called doxycycline.
Which is an antibiotic.
Which is an antibiotic. Right. And there's a couple others that can also be used if for some reason you can't take that. But doxycycline most commonly works very well.
What would be some of those symptoms?
Early on?
Yes.
The earliest one, rash.
The rash,
and
right.
that's just diagnostic. Otherwise, you might maybe have some achiness, almost some little flu-like, I just don't feel well, little achy type symptoms, which are non-specific, but when you put the whole thing together in the whole story, then you begin to come up with your conclusion and may decide to treat. If it's beyond that, and now say you're a month out from getting bit or something like that, and you come down with some symptoms and somebody is not sure whether it's Lyme disease. Now, what about the blood test? Is there a blood test? The answer is yes.
Yes.
Is it a great blood test? No.
Oh.
So you have to be careful with this. The blood test is most likely to help you somewhere between 4 and 6 weeks after a bite. If you do it too early, you may see nothing.
Right.
So the early folks, where you're not sure and they may not yet want to be treated because they just don't want to take antibiotics, and that's not unreasonable.
That's not bad.
Sometimes we'll wait a few weeks and then test them and see if that will help. But the blood test is a tough one because other illnesses, other diseases can make that blood test falsely positive. And that's why it's not the greatest. But
if you don't catch some of these symptoms, some of the later symptoms that you would get would be joints. A lot feels like arthritis, right? And these are the things that you were telling me earlier. You've got to be careful of, because if you don't treat it, then you could develop arthritis.
Right.
You know, and that, of course, that gets pretty serious. And I mentioned to the doctor, my sister-in-law, way back when, had gotten this disease, didn't know it for like 5 years, and of course had numerous issues and numerous problems with this. I think the bottom line here is that, and don't get fooled either, if you get bit and you see this rash and the rash goes away, that doesn't mean that you may not have caught the disease.
Absolutely
it just means that rash is come and gone.
Absolutely true, and I had a patient where that happened, where this patient got the patch rash and went to a local emergency room, didn't know what was going on, and they thought it was something else. And the patient actually, several months later, was in my office and said, oh, I did some reading, and I wonder if I had Lyme disease. And we went and talked about it, and I said, you know, maybe, I didn't know. And I did a blood test, and it was all positive. And I called her up, and I said, you know, you have Lyme disease.
You got it.
And I said, I want to treat you. She said no, because I feel good. And I had to talk her into treatment. She did take the treatment, and we treated her, and we're all good.
Boy, this is, you know what, Doc, we're going to have you back again. There are some other topics we want to talk about. Related back to school and some other things. And
Sure.
So thank you for coming in. And I think the takeaway on this, we're out a lot. Check your body, check your children, check your wife, your significant, and just if you see a tick and you see the symptom of a rash, fault to being cautious, right?
Absolutely. That's
Okay,
great
thank
advice.
you very much for coming in.
Thanks. It was a pleasure.
I'll see you again.
Okay.
To see this interview, head to our website, looktvonline.com.